Hi, I'm Danett C, Doctor of Acupuncture Asian Medicine, Women's Health Specialist, author, and speaker. And today I'm going to talk to you about postnatal depletion and Black maternal mortality. So for anyone who's been keeping up with what's going on, it's very clear that the rates of mortality amongst Black women giving birth are astronomically high. That Black women are 3 to 6 times more likely to die after giving birth than white women. And in one way, it's just wild. And then in another way, it, I believe, fits a pattern, even though this is an extreme, it fits a pattern of what we see with health disparities, and that this is a crucial area where we can see what health disparity looks like. So I mentioned postnatal depletion. So postnatal depletion is a series of health complaints that mothers can experience from right after giving birth up until, some experts say 7 or 10 years. I personally believe that the effects of that can affect things and last longer than that. I think in addressing and thinking about solutions, I think it's really important for us all, just community-wise, to understand that maternal health has a spectrum of possibilities, right? Some women after giving birth have little to no complaints, there's typical things, but some, just sort of bounce back, and then there are those who die. And I believe, and so as I learned about postnatal depletion, I learned about it after I gave birth, and actually lost a lot of blood at the labor, and then for years afterwards I was really sick. Like, I'm fortunate to still be here, and I think that as I learned about postnatal depletion, and there have been other names given to it, depleted mother syndrome, postpartum exhaustion, that some of the people that I had read their work, I don't know if they necessarily were working and treating women Black and brown women who face health disparities. I'm not sure that that is true. But I'm going to say, from reading and looking at research, and my personal opinion is that Black maternal mortality is an extreme of postnatal depletion. And I think that in solving this health crisis, in addition to the essential and the important things of increasing advocacy and adequate resources for Black and brown mothers, that we have to understand there has to be, I think, a broader awareness, just generally for everyone, men, women, children, societally, about the postnatal time. Like, I believe that there's more emphasis, even though all of us obviously are not treated well, or as well as we should be as pregnant women, but that usually is so much more than what we get after we've given birth, that the postnatal care time hasn't really been seen as something that is particularly of note and important, but it is. And so I think that we have to recognize the importance of the postnatal care time, and that we have to understand that there are physiological health issues that mothers can experience, right? So now it's more out there about the maternal mortality rate. But prior to that, it's been, if something is wrong, it's like a rare thing that a mother, the general tone in terms of what I've experienced is it's a rare thing for a mother to pass after giving birth to a child and to her baby. And then it's like, if she does have something, then it's postpartum depression, which is its own thing in and of itself. But I think there's been a huge gap in understanding that there are actual health issues that those of us who do survive those of us who do live after giving birth experience. And I think it's a really important part in getting to improve this crisis, because what I believe has happened is that there's an understanding that, Black mothers are dying at a high rate. And so I'm comparing it, and it's not exactly this, but it's the best example that I could think of in terms of what people would understand, is that we understand that in cancer, stage 4 is terminal, right? And so to me, it's like we are now understanding more in terms of stage 4, or that we have this terminology, stage 4 cancer, which would be likened to, let's say, Black maternal mortality. But we also have a range that goes on of health issues that women experience that go unaddressed. And this is, I believe, particularly important because for those of us who are more likely, who are already at more risk with dealing with health disparities, I think that this predisposes us further. And I think that there's important information in terms of maternal health, understanding that the side of that can help with eliminating Black maternal mortality. And I have more thoughts, ideas, and solutions that I'll be sharing with you. That's it for now. Take good care.